Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello, welcome to another episode of Prescribing Lifestyle. I'm your host, Dr. Avi Charlton. Today, I'm going to talk about understanding and managing weight loss stalls. For the purpose of definition, weight loss stall means your weight hasn't changed for 3 months. This definition is used by the doctor and Diversa Health because your weight can fluctuate from day to day. There's factors such as salt intake or hydration level, hormonal changes can cause a daily fluctuation in weight. The amount of food in your bowel can also cause temporary weight changes, or you might be constipated, or you might have drank a bit more water, or stress can make you hold on weight. Then there's muscles. If you're gaining muscle, you'll be leaner, but your weight might go up as well because muscle weighs more than fat. So if you're strength training, you might be gaining muscle. So you have to understand there's a lot of factors that makes our weight fluctuate up and down. But today I'm going to talk about 12 reasons why you might be having a weight loss stall, that your weight might be stuck. This is really common. A lot of people go on low carb or ketogenic diet, and in the beginning 2 or 3 months, they lose fantastic. They lose a couple of kilos a week and they're feeling fantastic. But after 2 or 3 months, their weight gets stuck and they feel like their weight isn't changing, despite they're doing the same thing with low carb or ketogenic diet. So I'm going to help you troubleshoot. And this is what I do at work as well. I have lots of people that come in and we talk about why you might not be losing weight. There's so many factors that can be playing a part. First of all, the first reason could be you're having some carb creep. You might be slowly eating a little bit more carbs and you kicked yourself out of ketosis, or you're not low carb anymore. You might be having a little bit more fruit, you might be having a bit more nuts, or slowly there's a little bit of rice and bread that's creeping in because you've been doing well and you thought you can have a little bit more carbs. That might be reason why that you are burning the glucose in the carbohydrates rather than burning the fat that you want to get rid of. The second reason could be protein. You might not be eating enough protein, which is the case for most people, or you might be eating too much protein. So most people don't eat enough protein. And if you're been ketogenic or low carb for a while, you might not be hungry. So you might be eating just 1 meal a day or 2 meals a day too often because you're not hungry and you're actually not getting enough nutrients in your body. So your body don't want to lose the fat. They don't want to shift the weight. They want to hold on to all the fat that they've got. And that might be a reason why your weight isn't shifting. You might not be achieving your weight loss goals. Too much protein can be the case as well. I've had some diabetic patients who eats a whole kilogram of mince and then add an egg or two to the meals. There is a thing called gluconeogenesis. So having too much protein can end up making more glucose and kick you out of ketosis. And even though you're eating mostly protein and fat, your protein becomes glucose. You might be just burning the glucose that you eat rather than harnessing the fat that you want to burn off in your body. The third reason might be you might be eating too much fat or not enough fat. If you're eating too much fat, you will be burning the fat that you eat. For example, some people have bulletproof coffee with butter in it or MCT oil. You might be adding extra butter to your steak. You might be eating fatty meat too often. If you have too much fat, then your body will burn the fat that you eat. Or you might be eating some fat bombs, which has got cheese or some almond meals into the fat bomb. Not enough fat will also cause a weight loss stall. So if you're following the low fat paradigm, your body might not be getting enough nutrients again. So you might be not functioning properly. You might not be making enough hormones. And in that way, you might not be having sufficient nutrients and your body's holding on to the fat and in a starvation mode. The fourth reason is you might still be eating too much calories. Your meal might be too big with protein and fat or maybe some carbs. And we don't usually suggest counting calories in a low carb or ketogenic diet, but it still matters. If you're eating too much food in terms of protein or fat or even carbs, then you might just be burning those foods, those calories, rather than burning the fat you want to get rid of. Number 5, you might be eating processed foods or having artificial sweeteners. There's diet bars, keto bars, Atkins bars, Cliff bars, protein bars. Quite often they are processed foods. They are low-carb processed foods, but if you turn around the packet and look at the ingredients list, there could be 50 ingredients with emulsifiers and processing ingredients or numbers and chemicals. They are just not natural. They might have artificial sweeteners like aspartame or check out my artificial sweetener podcast episode. Artificial sweeteners is actually shown to stop you from losing fat. These include Diet Coke or Pepsi Max or diet drinks. If you have artificial sweeteners, you're still raising your insulin, and that might be holding you back from losing fat. Number 6 reason is you might be having electrolyte imbalances. Maybe you're not getting enough salt in terms of sodium or potassium or chloride. Magnesium is another electrolyte that you might be lacking. If you're stressed, you might be lacking magnesium. Your body needs a lot more magnesium if you're stressed. If you're exercising more, you might need more magnesium. If you have cramps, you might be lacking sodium or magnesium. So you might benefit from extra salt and extra magnesium supplement. If you're not having diarrhea, you can actually have extra potassium. Again, you might need to troubleshoot with me with some blood test. And this podcast isn't medical advice, but that might be something you want to look into. Number 7 is food intolerances with dairy or nuts. It can be quite common that you can't regulate dairy. If you have some cheese or yogurt, you might have a little bit more and your body might not be tolerating with having dairy. You might be lactose intolerant. That might upset your bowel. And same with nuts. You might be nut intolerant or you might not be able to regulate nuts. I know if I eat nuts, I can't regulate it. I just want to keep eating the crunch and the saltiness. So if you are eating nuts and eating too much, that might be holding you back. Then I keep telling myself, just don't start. Don't start a little bit of nuts because I just can't stop. Number 8, you might be having other medical diagnoses or you might be on medications. So things like thyroid disorder, iron deficiency, or you might be on medications such as mental health medications. Those medical conditions or medications might be causing weight gain. So I can troubleshoot, and I am educated in the medical field to look at medications and medical disorders, and we might be able to do some blood tests and troubleshoot and see if that could be the case. Number 9 is alcohol. You might be having a drink or two once or twice a week, and sometimes you go out. Alcohol is the thing that if you drink the alcohol, your body will burn the alcohol first rather than burn any fat you want to lose. So if you're drinking alcohol 2 or 3 times a week, even though you're doing low-carb ketogenic diet, that might be just holding you back because your body just have a preference to burn the alcohol that you're drinking rather than burning your fat. Number 10, that's big, is stress or sleep. We live in a very stressful society. I quite often am stressed and I do lots of drop-off and pick-ups, running around, driving around with my teenage kids. And just having stress, even though it's a normal weekday stress, that can make your cortisol go up. And your body don't want to lose fat because your body is trying to manage the stress. Your body is trying to hold on to the fat and hold on to your body weight. So having stress, even if it's just a usual stress, can be a cause of a weight loss stall. Not getting enough sleep is just the same thing. So not getting enough sleep makes your cortisol goes up and your body doesn't want to let go of the fat. Number 11, you might be too sedentary. Some people might have told you that to lose fat, you just have to go low carb or keto. But having exercise, having strength training, going for walks can certainly help you lose fat. Building muscles improves your metabolism, and in that way, that will aid with fat loss. Number 12, and the last one, is you might be having unrealistic expectations. What do you expect? You might have lost 10% in the beginning and you still want to lose 10%. So let's say you are 100 kilos to begin with. If you lose 10% of body weight, then you lose 10 kilo. You become 90 kilo. To lose another 10% is 9 kilo. To lose another 10% is 8 kilo. So you might be losing less number of kilos, so you're losing from 10 kilo to 9 kilo to 8 kilo, but you're still losing 10% body weight. So sometimes we just have to be more lenient on ourselves and less expectations. We should be celebrating non-scale victories more. Quite often with low-carb keto, our brain functions better, we get less brain fog, we get much more energy, our skin is better, we have less pimples, maybe less breakouts, our skin feels more hydrated, we have better bowel function, improved mental health with less anxiety, less depression, or maybe less aches and pains, because maybe our arthritis gets better with reduced inflammation. So celebrate those non-scale victories. Of course, again, muscle weighs more than fat. A lump of fat is much bigger than a lump of muscle who weighs the same. So if you're gaining muscle with strength training, which is fantastic, you will look leaner with less waist circumference, but you might find just number on the scale is exactly the same. So we have to celebrate these non-scale victories that you might be having more muscle. So I've got just a few ways on what you can do to shift that weight loss stall. Maybe you can consider a little bit more intermittent fasting. So let's say you're eating 3 meals a day every day. You can consider eating 2 meals a day and even 1 meal a day. When I ask my patients, are you doing any intermittent fasting? Most people are doing a 16-8. I eat 2 meals a day and that's what I've been doing. So if you've been doing this for a while, 2 or 3 months, 2 meals a day, it might just help if you want to shift your weight to do some 1 meal a day some days. You might not have to do this every day, and it might just be 1 day a week. You do a 1 meal a day, or we call it an OMAD, 1 meal a day. So just do an OMAD once a week, and the other days you can do a 2MAD or even 3MAD. So that's a bit more intermittent fasting. If you can do a 24-hour fast, maybe you can do a 36-hour fast or even a 48-hour fast some days. Not all the time, maybe once a month. That might just shift your weight a bit. You might want to track your macros, because if you're having some carb creep, or if you're not getting enough protein or adding too much fat to your coffee, tracking your macros with apps such as Carb Manager, Chronometer, or even MyFitnessPal, that might be just a way to track your macros and see what's happening. Sometimes just being more mindful on what the macro ratio is that you're doing, that might be helpful. You might want to track your glucose or ketone level. You can wear a continuous glucose meter. You can check out Freestyle Libre or Dexcom, and you can, or even Vively is another company that sells continuous glucose meter, and you can see what your blood glucose is doing. That might be just an exercise for accountability as well. You can start checking ketones by doing finger pricks or even urine or breath ketones. Having ketones might help you to know that you are in a nutritional ketosis mode. That might help to being more conscious of what your body's doing. And then I've also learned from a nutritionist called Maria Emrich that she calls it protein-sparing modified fast. Maybe you can consider having some leaner, less fat days. Couple of days a week. Doesn't have to be every day. So reduce your fat intake 2 days a week. 5 days a week, you still eat lots of fat and lots of protein. Because if you eat less fat all the time, you won't have enough fuel for energy. You won't have enough fat to burn as fuel, and especially if you're low carb, ketogenic already. So you can try leaner days, less fat, more protein 2 days a week. Find your sweet spot for having the ratio of protein and fat. Make sure you correct your electrolyte balances in terms of sodium, magnesium, potassium. Manage your stress, and I always talk about breathing exercises, meditation, doing some breath work. Prioritize your sleep. Make sure you go to bed at consistent times and wake up consistent times. Exercise, especially strength train. Be careful with alcohol and don't rely on the scales. In fact, it might help for you to not weigh yourself too often. Just remember, practice self-compassion. This journey can be hard at first. You might get better, and then you might lose some fat, and then you might be stuck for a while, and then you might lose a bit more. You might gain a little. It's all a part of the journey. It might be up and down and bit of gaining weight or losing weight. It's all part of the journey. Find the right practice and your balance. Find the right balance in your life. You are your own equals one. So what works for someone else might not work for you. You just have to find it for yourself. Practice self-compassion. You are your own best friend. I always say, if you don't look after yourself, you can't look after everybody else, anybody else. So if you've got kids or elderly parents that you have to look after, prioritize looking after yourself first. So there's 12 ways on why you might be experiencing a weight loss stall, and I've talked about a few ways on how you can manage with overcoming a weight loss stall. If you're still stuck, you can come in to see me. I do this a lot. people feel tired or they feel stuck or they feel like their weight hasn't shifted, I will take a thorough history over a 45-minute consultation to ask you about what you're doing with your diet and your lifestyle, and we will troubleshoot together on why you're stuck. So, I hope this episode has been helpful. Stay tuned for more tips on how to improve your lifestyle and how I prescribe lifestyle in my practice. Thank you for tuning in, and thanks for looking after your health. Thank you for tuning in to another episode of Prescribing Lifestyle Podcast. Before we wrap up, I have an exciting news to share. I have a new ebook called Low Carb Made Easy. It's now available. This guide is perfect for anyone looking to dive into the low carb lifestyle. Inside, you'll find the basic theory behind low carb eating, a detailed food list, practical meal plan, and a variety of delicious recipes. It's designed to make a journey to better health easier, simpler, and enjoyable. For those who prefer a hard copy, head over to my website and register your interest using the link provided. My website is www.mlcclinic.com.au. Head to online store. Remember, the information shared in this podcast, it's for educational purposes only and not proper medical advice. Always consult your medical professional before making any changes to your lifestyle and diet, or you can come and see me in Melbourne Low Carb Clinic. If you enjoyed this episode, don't forget to subscribe, leave a review, and stay connected with us on social media. Your feedback will help us improve and reach more listeners. Lastly, if you found this episode helpful, please share it with your friends and family. Together, we can make a positive impact to our health and our communities. Thanks again for listening, and as always, stay healthy and happy. Until next time.